Hello and welcome to Downtown. I'm your host, Robbie Haig. We have been doing the Downtown program for quite a few months now. Many of you may not know that Downtown originates from Sandwich Community TV in Sandwich, Massachusetts. A while back, we changed from Sandwich Seniority to Downtown without any on-air discussion with you out there, or for you out there. I would like to publicly thank my Sandwich Community TV family for what they do for me in Downtown on a regular basis. Rob Vinciguerra, that's for you. And the show originates from here and, of course, is shown in many other areas. Today I am talking with Dr. Margarita Castro-Zarraga. Zarraga.
Yes.
Well, thank you. And George Classen. And I thank you both for being here. And the reason that you are here is Dr. Marga, they call you.
Yes.
You are the beginning of a new healthcare plan, Genera Health.
So it's actually a personal primary care plan. So we call it a Genera Personal Primary Care.
Oh, how nice.
Yes. It's a membership-driven primary care office. And what's new about it is the emphasis and the thinking behind it. So I could get into that.
Oh, yes, I'm sure you could. Yeah, and we will. And George, your part in this, you are a benefits consultant.
That indeed I am.
I think most of us really get the gist of benefits. Very interesting how both of you are working together for the common good. Let us start with you, Dr.
Yes.
Marga. Why are you in the healthcare field?
So I'm one of those kind of doctors who decided to be a doctor when I was a child. I was very touched by actually my grandfather. No one else in our family is a doctor, but he was actually a lawyer. But I saw how beloved he was to his clients and his community. He was very prosperous and wealthy, and he inspired me to gain a particular influence over a community. So when I wanted to travel to the United States because I felt that this was a country of innovation and advancement of research in my field.
And where were you coming from?
The Philippines. I grew up in the Philippines.
Very good.
Yes. And aside from that, I actually chose medicine over law because I felt it appealed to my softer side. I believe life experiences as a young child, my parents did separate and when I was at an early age. And I think I used that to develop in me empathy and listening skills that otherwise I would have developed probably later on in life. Okay. But I used it basically and developed strengths over a very difficult period of my life. And so I find that using my gifts in building relationship translates to me being able to care for people most effectively.
Wonderful. I'm impressed also that your father as a lawyer instilled these...
Grandfather,
sorry.
Yeah.
Instilled these wonderful things in you.
Yes.
That's wonderful.
Yeah.
So when did you come here?
2006, my husband started his master's in business administration in Kellogg School. So I came here as a foreign medical graduate. It was a very challenging road to compete in my field and land a spot to train. And I started training at the Brigham and Women's Hospital, where I was fortunate to be welcomed as a sub-intern at the ICU of the cardiac surgery unit. And I chose that first job because I really loved promoting heart health. Except we were at the very, terminal stages of heart disease, which is I witnessed a lot of heart transplants, open heart surgery, the best technology in that field. But I again went back to myself and thought, what I really want to promote is the prevention of illness. And so I had the opportunity to choose what field to train in, and I chose family medicine because of that broad spectrum, as they say, from the crib to the grave.
Right.
So I've done it all through University of Massachusetts after I trained in New York,
Very
Brooklyn
good.
Hospital.
Well, by your pamphlet that I
Yes.
have in front of me,
Yeah.
You've become extremely interested in how people are being taken care of.
Yes, yes. So I've spent some sleepless nights, with feelings of frustration and non-fulfillment from my experience as a rushed physician in various settings that I've had to work out of. And when I do spend the time with a patient, it's, I would say, mentally, spiritually rewarding, but it's not something that is rewarded in terms of the fee-for-service care.
Very good.
So so in other words, I feel like I've had to choose between my values versus what my instinct to survive. So I felt like the best way to address this was to start my own practice. And I found myself one day projecting my future in 15 years and imagining looking back. And I made a choice. How do I see myself in terms of what I would have fulfilled in 15 years? What impact would I want to have with a community of patients?
Wow.
And my decision at that moment was, I would rather be able to deliver affordable, quality health care to the most number of people that I could reach.
Wonderful.
And one sleepless night, I woke up and said, I'm going to name that group Genera. And I don't know
Excellent.
where that name came from, but I woke up like in the middle of the night and then slept again, and I said, let me type that name out before I forget.
Some of my best thoughts are in the middle of
That's
the
right.
night
Yeah.
when we're relaxed.
Yes.
Well, it sounds like such a wonderful concept.
Yeah.
And you want to talk to your patients and have a kind of a camaraderie,
Yes.
which I think is wonderful.
Yes. So with the help of a community, we're called Direct Primary Care, New England.
Very good.
Out of that community, I was able to solidify my practice and my group as Genera Personal Primary Care. So up and coming in the United States is a group of doctors who practice the direct primary care model. We do not need insurance to accept patients. Just like a regular gym or even a spa in your neighborhood, your doctor's office will be accepting membership fees to be able to gain access to quality health care. And what do I mean by quality? We've mentioned relationships again and again already in our first few minutes in this show. Relationship is key in terms of bringing in accountability to meeting your health goals. We are social beings. It only makes sense that we meet our goals together. And if you have a learned person like your physician providing you with the tools, then you become enriched, empowered, enlightened. And that's the kind of relationship that I would like to build with my patients, versus what I've already experienced in some traditional models where, as President Obama said, we are really have been limited to about 8 minutes in front of a doctor.
Right.
So you're basically asking to speed date your doctor. And, and that's not a way to make any, form any partnership or meet any goals. And I think...
And I would think, I'm sorry for interrupting
Yeah,
you,
that's
but
fine.
I would think also that you don't get a feel for your patient and what their problems are in that shorter period of time.
So thank you for touching on that, because George can also speak to this. You talk about it in
Thank
your
you for
website,
being so
George.
patient, George.
You talk about proactive and reactive medicine, and we in our group, Genera Personal Primary Care, we're championing what proactive and reactive medicine is, because if there is something that can be prevented, as they say, 1 ounce of prevention is equal to a pound of cure. 1 ounce of prevention is equal to a pound of cure, and it's not impossible to meet that. We just have to create structures. And, you know, with me networking with Direct Primary Care New England, meeting people like George Classen, now we have this, we're trying to form a strong network to get this message out there, because we know there are people who are looking for this information and, you know, to actually save dollars and yet get more. So maybe George would like to talk about his journey and how he's offered this to groups of people and families. And
tell us what your part in this is as a benefits consultant.
Absolutely. Well, I've been doing this for around 10 years, and I realized pretty quickly that there's serious challenges that involves employees getting health insurance and health care, and that health insurance and health care is not the same thing. And
very well put.
I took a deep dive into what I could do as a consultant to improve this for my clients and for their employees. And I read a couple of studies done in other parts of the world, and there's a lot of consensus in America as well, that if you want a healthy population, you have to invest in good primary care. Yeah. Unfortunately, our current fee-for-service model allocates 3 to 5% of the cost, the premium dollars collected, to primary care. Also, doctors are, they have to see 23 to 25 patients every day. That leaves them about 7 minutes per visit with a patient, of which half that time, during that 7 minutes, they're looking at a computer screen to keep up with coding and administrative work. And on top of that all, after seeing 20-something patients a day, a doctor spends more than half of their time now doing administrative work so that they can get paid for their services. Right. Another thing that happened is the large hospital groups started to buy up all the independent primary care practices. There was a report out, an article last week that said in this area, Massachusetts, every primary care doctor that works for a hospital group generates $2.5 million in revenue for their employer. Wow. Now this is because of referrals. There's also what's called perverse incentives, where people are sent for procedures, they're sent for diagnostic testing and radiology. Unnecessary. That's unnecessary and downright dangerous in a lot of cases. Right. And this is all because the business model is a revenue generating business model. Now, the doctors that I've spoken with that have broken away from that system, that are doing direct primary care, there's several reasons that they broke away from the fee-for-service model. The number one reason is because they felt terrible that they cannot take care of their patients. They went into medicine because they wanted to help people. And because of the system, their hands were literally tied behind their backs, because you cannot take care of somebody in 7 minutes.
And unfortunately, in more ways than one. Of course, I've told you that I've been in the healthcare business all of my life. And when a doctor is told what to do and when to do it, it doesn't make for good dynamics between doctor and patient or anyone else.
That's right. And one thing that we can't overlook is that the medical profession today has the highest suicide rate in America compared to any other profession. Wow. Now, these are intelligent people that suffer from burnout. A lot of things, this is related to stress, being overworked, being unhappy at their careers and professions. Now,
thank you for bringing that up.
Yes, because not too long ago, the number one suicide rate was for people who dealt with airplanes and, monitoring airplanes and so on. That is quite a shock.
Yes, and the point of healthcare is to keep people healthy.
You would think.
And we can't do that to a population if they don't have easy access to good primary care.
Mm-hmm.
Now, in my work, I work with a lot of insurance companies and insurance. And the fee-for-service system is insurance-based. Now, the way costs have shifted onto the people who are actually using the healthcare system, how their benefits plans have shifted, where most people today are walking around, I call it functionally uninsured, because in a system with no transparency, when they access the healthcare system and they flash an insurance card, they have absolutely no idea what anything is going to cost them. And they don't have access to quality ratings. They don't know if the people that they are seeing are the best at their job and at their profession. Now, what happens when people are scared to go to the doctor because they might face financial hardship or financial bankruptcy?
Mm-hmm.
They don't get the care they need when they need it.
Right.
Now, then little things, little health problems escalates into major medical, life-changing medical events down the road that are extremely expensive. Now, what most people don't realize is primary care doctors are trying to take care of many ailments, including a long list of chronic ailments and diseases. They just don't have the time to do it. So what's happening today when somebody goes to a primary care doctor in a fee-for-service system? The poor doctor is there looking at a keyboard, trying to figure out who this patient is that they maybe saw a year or 2 or 6 months ago for 6 minutes. And they're trying to figure out what prescriptions to give them, what tests to send them for to make their administrators happy, and what specialists to refer them to. Because that is what primary care has been regulated to in our healthcare system. And it's not to the benefit of the consumers of healthcare, us, the people.
And when I first spoke with you, Dr. Marga, I got the feeling that you wanted to take care of the person to the best of your ability instead of sending them on to specialists.
Correct. I mean, was this the reason? Actually, family medicine is, like, as I said, I chose it because it had the broadest amount of skills that I could provide, and it's actually, you're the jack of all trades. So if you, and I've morphed into so many versions of a family physician. I've done geriatrics, I've done urgent care, I also even treat opiate addiction. So the way the discipline is, has morphed is you become what your patient needs. So I wanted to pick off some of the pain points that George has already touched on through a story. So just for example, last week, I had a person signed up for the practice, and her issue was she called 30 doctors to get a physical therapy prescription to rehab her jaw in a physical therapy office because she broke her jaw when she fell flat on her face. So 30 calls, none of them could accept her, and everybody was full. So basically, she signed up for my clinic. She called on a Tuesday. I met her on a Thursday. She has her physical therapy script. We're meeting each other today for her annual physical.
Excellent.
So that's one example.
That's the way it should be.
But I don't end there.
Okay.
So her annual physical now, we partnered with a laboratory that will offer 90% discount compared to what is offered in the local hospital. So
I was most impressed with that because that takes a lot of negotiation.
Not really.
Really?
No. So thank you for telling me that.
Everything is so overinflated in the healthcare industry.
There was no, so thank you for having that reaction, because I'm here to tell you all it required for my office was to speak to a greater purchasing organization who is partnered with Quest Labs. And Quest Labs will extend this discount to my members They basically bill me and I bill my patient. So there's no, some clinics do choose to add on a fee. I don't. So for me, I've built the clinic so that we're okay with just the membership fee.
And let's use an example. What does
Yes.
a lipo panel cost?
What?
Cash pricing.
Which
if somebody
one?
wants to check cholesterol,
I don't remember exactly, but it was like
under $10.
it's like 110, and then you can get it for like $7 or $14. But I'll go
That's
with the
right.
CBC. The blood count is to check if you have an infection. It's $3. It becomes $33, and these are
Yes.
prices from my own
Right.
Wow.
bill.
And,
So-
and we've all seen insurance bills where those same procedures cost $300 to $600.
Sure.
Because somebody's using an insurance card.
Yeah.
So just to be very clear, because this point can't be muted in any way, my husband and I listed down the most common lab tests, which include checking if you have an infection or any hint of cancer. Your liver is checked, your kidney is checked, you're checked for urine infection, want to check your thyroid, screen you for diabetes. We totaled that whole test set using the prices we were given from our own care. And it was $796.
Wow.
And when we computed it for a patient who would get that through my clinic, it's $52.
Oh my goodness,
Yes.
that's unbelievable.
And we have
just with that, you've basically paid for half of your year's membership
Wow.
to have
that's
access to your own personal doctor that you can
That's a
text,
good
call,
one.
or email, or go and see. And if it's absolutely necessary, you can get a house call.
Yes.
It's the way primary care used to be practiced.
So you mentioned the year's membership. Now, for the year's membership, you also
So what we're for our clinic specifically, we've chosen to take the route of being very transparent in terms of the number of visits that a person would like to purchase.
what I was hoping you would talk about.
Yes, so you're basically buying the time of the doctor. So we have 3 different plans. You want me to go into detail?
Sure, skim.
Okay,
Yeah.
sure. It's plan 3, 6, and 12. So plan 3 is 3 live visits to the doctor with an annual exam. So you really get 4
Right.
face to face.
Very good.
And then you go up from there. So plan 6 is 6 with an annual exam. So that's a 7,
And
plan
that
12.
generally would be somebody who had more
Issue.
problems. Yeah.
But I also wanted to frame it this way, since I'm promoting proactive medicine. We actually framed a conversation where it's not going to be problem based. It's how, if you're driven to a particular health outcome like weight loss, that's the whole point of us meeting more frequently.
Excellent.
And they can check in as well. The 2 other things, we've covered the labs extensively. The other thing that's missing here is like the phone call. So because we have to acknowledge the development of technology, video conferencing and phone calls are also something that we can do because the doctor is not burdened with so much paperwork, too many patients. So it really that's like becomes the basis of the relationship.
And that's in everybody's advantage because it's efficient.
Yeah.
It saves the doctor time, it saves the patient traveling time, it saves the patient waiting time. They can get something they need done right away with technology.
And that is something that I want to bring up because it's very
Yes.
important. The doctor's time is very important, but so is my time.
Exactly.
We're a busy
Yes, society.
society. We
So
are.
yesterday I was able to help out a person. She was actually poised to have a 15-minute, I do a free 15-minute assessment, but it was scheduled for Friday and she had back pain. So I picked up the call and I screened a couple of questions and I assured her that, I don't think this is an emergency. And then I gave her a choice. You can see me once in the clinic, but that would be more expensive. Or you can try it out. We're not here to tie down anybody. You can try it out for a month and then leave.
Wow, that's wonderful.
Because the whole point of any good establishment is treat another person the way you want to be treated.
Absolutely.
So I'm just putting myself in the person's place.
Yeah.
I don't want to be tied down with something I don't know.
Very good.
So
And
sometimes if we just exercise common sense and just a little flexibility.
you mean if we bring back common sense?
Maybe.
And
Nice.
I would like you to give your information, your phone number and so on.
Okay,
because
thank
we
you.
certainly wouldn't want it
Thank
to be
you so
left in the
much.
dust.
Genera Personal Primary Care, 508-591-0655. We are located in Needham, and we started in Plymouth. So we're both in Plymouth and Needham. And our website is www.generamd.com. That's GENERAMD.com.
Very good.
Thank you.
Okay, and now we can finish it up. There's so much information, it's worthy of more than one show.
Yes.
Absolutely.
Because
Yes.
there's just so much. I'm so pleased that you did get in that your fourth patient and using their time appropriately as we would use your time.
Yes,
And
that's
the
right.
fact that you have a business with insurance that you're,
I'm consulting around insurance.
I love it.
But I would just
Love
like
it.
to enlighten everybody a little bit.
Yes.
People are probably wondering, how did a doctor
Yeah.
match up
Yeah.
with an insurance consultant?
Yeah, that's
How-
right.
Especially a doctor that doesn't take insurance.
Yeah, that's a
Now
good
that's an
one.
interesting story. So I'll be brief.
That
but
is, yes.
but one of the services that I provide to my clients, these are employer groups with several employees, anywhere in the range from 5 to 500, is their biggest challenge is not just cost, it's the employees are having a hard time getting access to healthcare,
Right.
even though they have fancy insurance cards.
Right.
Now, I go to my groups and I have several of these that we incorporated access to direct primary care services for the employees as part of their benefits package. So now the employees for these groups all have their own personal direct primary care doctor that the employer pays 100% of the membership for. So guess what? Employees spend a lot less money on their health care and
Yes.
they miss a lot less work.
Yes.
They have a relationship with a
Wow,
doctor
good.
and they really value that. I've gone to a lot of employers about 3 months before the renewal and I say, okay, we're going to be talking soon, we're going to get your renewal rates and everything. And they say to me, we know you're going to do a good job with our renewal, but I just want to tell you, don't think about taking away the direct primary care for the employees. That's the one thing they like the most of the
Excellent.
whole package.
Excellent.
And you know what happens when you do all these basic things right?
Yeah.
One of the healthy side effects is that you lower the cost of the money they're spending. And everybody has been told you can't control the cost,
Yeah.
but it's not true. You
It's
can
not
do
true.
it, but you have to be smart
Yeah.
on how you do it. And that's why I'm in relationship with all the direct primary care doctors, because
Very good.
I see that as the number one solution for businesses out there today. If they tie that in correctly with their insurance,
Yes.
they have a healthier, happier workforce with
You
easy
made
access
a smart move.
to good health care.
So can you imagine personal care made affordable and getting more for
Yes.
less money?
Yes.
Getting more for less money, it's like nobody can believe it. And that's why
It's a
thank you.
no-brainer. It's truly
Yes.
a no-brainer.
But thank you for having us.
Oh, thank
because-
you for being here. And I'm sorry, but our time is up. And maybe we could continue this at another time.
Oh, yes.
We'd love
We
to.
would love to.
It's
Thank
going to be
you.
the most discussed topic
Yes.
between now and the next election.
Yes.
Oh, my.
And
You're going to
thank you
get a lot of
for
viewers for that.
Wonderful.
getting this information on its way.
Thank you so much.
Thank you.
And thank you out there for being part of this. You are watching Downtown, coming to you from Sandwich Community TV, and I'm your host, Robbie Haig. I hope to see you all again real soon. Thank you.
Awesome. That was great.
Thank you, Robbie.